Perfect. Welcome everybody for today's Power Hour session. I know there's only a couple of you, but hopefully more will join, and hopefully we'll be able to upload this session. And I know we get a lot of engagement on YouTube on the videos. So if you're watching on YouTube, thanks, and welcome again. Today's session will be done by both me and Fungai. Fungai is an expert on all things SCA, and hopefully she'll give us her insights on the exam. And I will talk to you about the AKT and what the exam is and how to prepare for it and what are those pitfalls that people have. All right. So let me just share my screen. So hopefully you can all see that. And Fungi, if you can just keep admitting people into the room, that'll be amazing.
Yeah, of course.
Right. So welcome to this session. We're going to be talking about AKT. So I work in Swindon and I work in the Urgent Treatment Center, but I also have a couple of other fellow roles, as you can see on the screen. And I think I might probably have introduced myself in previous episodes and other events as well. That's where I work. So just talking about the exam as such, the AKT exam is one of four things you need to do to pass and become a GP essentially. So the four things are your portfolio, so all of your reflections and all of that set of things. And within that is your workplace-based assessments, so all of your assessments at work. And then the AKT, that's MRCGP Part 1, and then the SCA, that's MRCGP Part 2. So all four are, I would potentially even say, equally important to get the MRCGP and to become a GP in this country. But the AKT is, as such, is very similar to the MSRA exam, MCQ style questions. They happen 4 times a year: January, April, July, and October. Next week is the AKT exam. And about 6,000 people write the exam every year all across the country. You can have up to 6 sittings, so you can fail the exam 5 times, but that doesn't mean you take all those five opportunities. I really hope that those of you who are um, writing the exam pass the exam in the first instance, because the exams are quite costly, £481 as of now, and you can pay it in installments, which is very good. And ideally, we want you to take the exam in your ST2 in your GP placement. The AKT from this particular one, from next week onwards, the AKT they've reduced it from 200 questions to 160 questions. All right. And that means that they've reduced the time as well, so 2 hours 40 minutes. So you have about 160 minutes and 160 questions, so about 60 seconds per question if you don't take any breaks. 80% of your questions are going to be on clinical topics, so various clinical topics. We'll talk about where to find that curriculum. 10% is going to be on statistics. 10% is going to be on organization and admin as well. Over the past 6 or 7 AKT exams, the average pass mark has been around 69 to 73, 74. So that's so around 72%. So to just barely pass the exam, you need to be getting 115 questions right out of 160. But to pass comfortably, I would say at least 125 questions out of 160. So you have a very narrow margin that you can get answers wrong. I'm just showing you just a couple of sample questions. This is how they look. They'll give you a topic header. They'll give you the words, and then you have options. There's usually 5 options. So this type of question is probably going to be the main type of question you're going to see. About 70 to 80% of the questions are going to be like this. All right. You might have questions with extended match. So each is going to be one topic, but then multiple options for each, and you have to match the right option to the right question. So it'd be like a bracket of 3 questions with the same options. You will have a few pictures at least, so mainly dermatology, sometimes sexual health as well. So again, make sure you're using really good resources for that. We'll talk about where to find those resources. So you will have pictures in the exam as well. You will have statistics questions. Now, this question might look completely complicated right now, but as and when you progress in your training, and as you practice your AKT questions, hopefully this should be quite straightforward. You're supposed to answer this question in less than 60 seconds. If you haven't done statistics, there's really good resources. I literally just finished a statistics course for the trainees in Bristol as well. So you could access those courses. Um, this is again a standard question on admin. So you might need to know how your practices are run, how is the NHS England in relation to primary care run, what are the different types of things you need to know about registering practices, DVLA, fitness to fly, all of these things that are not technically medical, but that you need to know as a GP in terms of running a practice. I've just put this graph here that I showed at the TPD conference last week. This is what the pass marks, the pass percentages have been for us in the Southwest. Now, if you look at the last AKT exam in July, let me just use my annotation tool. In July, so the dark blue is IMG's pass percentage. So only 51% passed the AKT if you were an IMG, as compared to 92% of those who were non-IMGs. And then obviously the aggregate is 62%. So if you look at that, every single time the AKT is run, non-IMGs do a whole lot better than IMGs, 54, 73, 55, 76. And the reason I mentioned this graph is because it is quite important if you're an IMG to ensure that you are working harder and smarter as compared to your non-IMG colleagues who would not have those same challenges as you do, because coming from different backgrounds, we are tested in different methods in our medical school. We're not used to the phrasing of the questions. We're not used to kind of these style of questions as our UK graduates would be. Very quick example. My wife is British. She did her medicine over here, and we both sat the AKT at the same time, and she would just skim read the question and choose the right answer, and then I've still not read the question. B, I'd be bogged down in thinking about the question in a different way. And she even now she would admit this. She would say that I have much more knowledge in terms of clinical knowledge than her. I have lots and lots of facts based on how I did my medicine training. But her style of doing the question was just different. And so I had to learn how to do the questions in her style. How to prepare for the exam? There's four main ways I would say, right? First, you need to study the curriculum, right? The places to find the curriculum is mainly the RCGP website. So super condensed guides, clinical topics guides, previous AKT feedback reports. I'll show you where to find them all. Nice CKS is going to be one of your closest friends when you're preparing for the AKT, and the BNF treatment summaries as well. I'll show you where to find them. You need to make a good calendar. You need to have a plan for your preparation time. You need to plan in advance when you're going to set the AKT. You need to break down your plan and calendar over a few months, over weeks, and then over days, and what you're going to do every single day. If you don't have a calendar, studies have shown you're not going to pass the exam. I would say get a study partner, ideally a group of two, maximum 3, 4 can get a bit tricky because you might not have the same free time. Might not be on the same rotations. Share topics amongst yourself, test each other, make up questions for each other, push each other, and that's how I pass the exam. Use the different methods of the VARC learning styles. We'll talk about that in a second as well. Don't just keep doing questions, questions, questions. I've had trainees who have supported, who failed the AKT before. They said, Isaac, I've done 200 questions every day for the past month and I still failed the exam. So that's not the way to prepare for the AKT. You need to have a good understanding of the subject, and it's not only going to be questions, questions, questions. Use different learning styles. So you're talking about the resources. Curriculum, AKT feedback reports. All of you have RCGP membership, so you'll have access to all of this. GP self-test is where you'll find the previous questions of the AKT style questions. They might not be the best questions, but they're really, really good. Most of them are retired AKT questions. Innovate is a magazine you have access to on the RCGP website. Again, every magazine has AKT style questions in that magazine written by AKT examiners. So make sure you access that magazine online on the RCGP website. E-library. Professor Harris has some good resources on data interpretation and statistics. It's again on the RCGP website. This is where you can find the clinical topic guide. So if you click on any particular topic, you can see what the role of the GP is in that particular topic. What are the emerging issues? What are the knowledge you need to know? So that's how you know exactly what you need to know for the exam. Super condensed guides, you can find that as well. So same thing in a condensed format for all the topics that you need to know. So have a read through this, start ticking them off during your preparation. I would even say print them out and start ticking topics off. Previous AKT feedback reports also found on the RCGP website. This is what it looks like. So from the April AKT, we don't have the July AKT report yet. This is what the topics that the trainees found difficult in. So diagnosis of common neurological conditions in children, or management of long-term conditions. So these are the areas that people are finding difficult. They're going to retest you on these specific areas. The pass percentage in that was 72%. In that was April. In July, um, um, common design studies, diagnostic investigation, recognition of neurological symptoms. So these were topics that they found quite difficult. So they're going to retest you on these topics. So the AKT feedback reports are quite key for your preparation for the AKT. So go through the previous reports to see where your colleagues and your seniors couldn't perform well on. GP life resources, so nice CKS. So like I said, I put 2 stars over there. Absolutely key for your preparation. You need to know every nook and cranny of nice CKS. Other national guidances like sort of like BTS and sign and things like that. BNF treatment summaries, Oxford Handbook. If you're using the Oxford Handbook of General Practice, make sure it's the latest version because the previous versions have outdated information. BMJ Best Practice has really good information as well on treatment guidance. This is where you'd find treatment summaries. So just search BNF treatment summaries. This is what it looks like. There's about 200 or 300 topics, which essentially click on a topic. It'll give you a general summary based on the BNF, how to manage that particular condition. So you can choose any of those topics, and some of them are longer. Some of them are really short, like zoonosis only has a couple of paragraphs, but really good to kind of give you a general summary of how to treat a particular condition. The different WARC learning styles we just talked about. So if you're a visual learner like I am, I learn by seeing patients, YouTube videos, looking at guidelines and flow charts. That BMJ best practice has really good pictographs and infographics. Flashcards, if you're using flashcards, make your own. Reading journals and looking at those images and graphs and pictures. So if you're a visual learner, look at all these things. If you're an auditory learner, make your buddy read your guidance is allowed to you. So when I was preparing, I would have to put my kids to bed, and then um, I would ask my friend to join me on a Zoom call, and then she would read out the guidelines to me while listening. Listen to podcasts. I tell you which ones as well. Maybe you can record yourself. Send yourself a voice note and record yourself reading a few guidances. And when you're mopping the floor or doing the dishes, you can just put your earphones on and listen to those guidelines. If you're an R kind of a learner, again, guidelines, flowcharts, make notes, make flashcards, learn by getting those buzzwords from each question. So if your question says, the 39-year-old lady after a long flight presented with with swelling and pain in her left calf, you just obviously got all those buzzwords. You're thinking DVT. Your question is going to be DVT. If you're a K kind of a learner, Um, practice with patients at work. After you've seen a patient, read up the guidance immediately. Speak to your practice manager, speak to your practice pharmacist. This is really good for the admin side of the AKT exam. Other resources, Past Medicine has really good questions. You have to pay for it though. BMG on examination as well, really good questions, but they might not always be at the best level, might be pitched a bit higher. But again, for these two are paid resources. There's some free ones, Pass Test and iMedics that you can access online as well. Again, with these free resources, we can't always vouch for the quality of the questions. But the resources I mentioned before this, all the RCGP self-test, all of that is more than enough, to be honest. Courses, the AKT, the faculty, the RCGP faculty does courses, does 1 day essential courses. You might be invited to the AKT specs course or the AKT SCA course. So the specs courses are useful. 14 Fish, I think you have access to the AKT package. If you don't, speak to your deanery, your batch manager as well. Some podcasts, if you listen to podcasts, RCGP e-learning podcast, Red Whale podcast, GP Notebook, Primary Care Knowledge Boost. All of these are really so. Just in your podcast platform, I just searched RCGP as you can see, and all this came up. No, your AKT podcast is a new one as well, so really useful if you're driving on a long drive or doing the dishes, like I said. For images, look up these two websites, DermNet NZ and PCDS. Really good and up-to-date guidances and images. And I've heard that PCDS images have been used in the past. I can't vouch for it. Mocks is a really, really important tool for you to pass your AKT. You have to do mocks. You have to get used to sitting for 2.5 hours staring at a screen, doing questions, and not being able to access your phone or being able to get up and fidget around. So, absolutely important to do mocks. GP self-test will let you do mocks. 14 Fish will let you do mocks, or you can pay for some mocks from other locations as well. Maybe ask your TPDs. We in Swindon, we support our TPDs, our trainees for with some mocks as well. I think Fungai also done a mock, if I'm not sure. In terms of timeline of preparation, depends on many factors. Are you single? Are you married? Do you have kids? Do you working full time? Are you part time? Are you in AME? Are you in GP? So many things to consider. I would say for most people, you need at least 4 to 6 months. Some of us lesser than that. I'm not that smart, but 4 to 6 months of at least 2 to 3 evenings per week where you spend good amount of time, and then 1 day per weekend where you spend a good amount of time as well. If you're spending a dedicated amount of time like this, you will pass the exam. Don't make the mistake some of my friends made, where they took the exam too lightly and they're like, "Oh yeah, I passed the MRCA. It should be straightforward," and they failed the exam. So it's a costly exam. Don't take it too lightly. All right. When you're preparing, during preparation, make sure you're taking regular breaks. I'm not sure if you heard of the Pomodoro technique, where you do study intensively for 25 minutes and then you take a 5 minute break. 25 minutes, 5 minutes, 25 minutes, 5 minutes. Or it's really, really found to be helpful to take those regular breaks. Don't just work for like 3 hours and say, okay, I'm going to take a break after 3 hours. Do the 25 minute breaks. All right. Repetition is absolutely key. So you might understand everything you're reading, but you if look at this first graph. If you are you today is today you read a particular topic, you understood the whole topic, you have 100% memory of what you read. If you don't refresh it, studies show you'll forget all of it by 3 days. But let's say on the next day you just do a quick refresher, your memory goes back up, and then the 2 days later again a quick refresher, it stays. If you do that a couple more times, you're gonna retain a lot more of the topic. Repetition. Repetition is absolutely key. This is called the Ebbinghaus forgetting curve. All right. If you're using flashcards, I would not recommend buying any flashcards. If you're making flashcards, make your own flashcards. That's how you will learn. Again, I'm repeating mocks because mocks are absolutely key for passing the exam. Make a set list of of essential topics. These are high value topics. Like for example, how do you calculate Chadras score, or how do you calculate Wells score, or things like that that you'll understand in the moment, but that's something so easy to forget, or stats formula so easy to forget. you put that on the list, and then you repeat that again and again and again. All right. And then once you have a good list, just keep repeating those topics again and again. Exam tips as such, I can't stress how important exam technique is. You need to be able to do the read the question, look at the question header, read the question twice, scan for those buzzwords we talked about. I sometimes try and picture the patient when I'm reading the question. Look out for those small words, usually, commonly, most likely, least likely, and be prepared for the different styles that I showed. Another good thing is something called the cover test, where you cover up the options and try and guess what the answer is before even looking at the options. And most people who have practiced that method well end up scoring really high marks. Flagging your questions. So there is opportunity to flag the question in the exam. I would say potentially say think about how many questions you're going to flag and why would you want to flag a question, because I don't want you to have that safety net of the flag. I want you to give you the best attempt when you're attempting the question. And you won't have much time at the end. Like I said, you have only 60 questions if you don't take any toilet breaks and so on and so forth. So think about how many questions you're going to flag. I'd say a maximum of 10 if you have time at the end. On the exam day, make sure you're eating well, sleeping well, make sure you have the right IDs. A recent trainee of mine got caught in the trap because she forgot to take two IDs. You're supposed to take two IDs. Make sure you know where the location is. It's usually going to be the driving Pearson View driving center near you. So go there a couple of days before. See where you're going to park. See how much time it's going to take for you to get there. Do all of that before the exam. All right. This is what your screen is going to look like. You're going to have the calculator up there. You're going to have the time on the right. You can flag on the right, and this is what your screen is going to look like. Questions and then options on the right usually. You'll have to click on specific buttons to look at the graphs and things like that. So just make sure you're clicking on all the buttons for each question. This is what the online calculator will look like. You can use either the mouse or the keyboard for that as well. And this is what a free text question will look like. So it says to calculate the mean. So you just calculate the average and put the answer in the box over there. On the exam day as such, make sure you're dressing warm, eating well, drinking enough. Think about taking a comfort break. Carry your IDs with you, like I said, relax. And absolutely key to have a positive mental attitude that you're going to pass the exam and you're going to do well in the exam. All right. So that's it from me about the AKT. I'm just going to hand over to Fungai to talk about the SCA. While she's sharing her screen, if there's any questions, you can unmute and ask me questions, and I can have a look at the chat function as well. So any questions while Fungai is sharing her screen? No. Yeah. If you are an IMG, I highly recommend uh, taking this exam really seriously, as I've shown you the discrepancies in, or rather the differential attainment in passing the exam. How are you going, Fungai? Sharing your screen? Any trouble or?
A little bit. Can you see this?
Yeah. Just put it on presentation mode and we can see.
Okay.
Perfect.
Yeah. Okay. Yeah, so hi everybody. Thank you so much, Isaac, for sharing with the AKT. It's really important. And, at the risk of too much repetition, it's important to really emphasize to say, the AKT, SCA are important exams, but actually the portfolio, workplace-based assessment are equally important. So the whole purpose of, doing this Power Hour series, and in particular this exam one, is just to get you in that mindset to begin with the end in mind, to understand that your goal in terms of CCT is to also prepare for these exams. Try not to sort of push it to say, when I'm in ST2 or ST3, then I'll start preparing. Use even the time that you have now in ST1 to start preparing for these exams. And when you know what's expected of you in the exams, then you know what you're starting to prepare for. So I'm going to jump in straight to the SCA. And so we're going to go through the format, some strategies, common challenges, and some resources that you can use. We'll also just be talking about how you can, understanding the expectations of the exam, how you can for that in your current rotations or in the various sort of teachings that you have with your VTS or some courses that are offered. I know you guys didn't ask anything, but I'm sure you had lots to ask with the AKT. So even with the SCA, if you want to ask something, maybe get clarification, please do feel free to either just shout. We don't mind being interrupted. Or if you put it in the chat, then Isaac will stop me or jump in. Yeah, so this is what we were just talking about, isn't it, in terms of what you need to be able to CCT. And as you prepare, as you do your workplace-based assessment, think about that, because when the AKT questions are being set, they are set in the context of you are in a GP surgery, you encounter a case like this, similar to the SCA as well. They are not cases that come maybe from a hospital placement or that are too theoretical. They are everyday things that you encounter. So make sure to use every opportunity to learn, in particular if you're in the GP setting. And if you're in hospital, to actually wear your GP hat and say, if I were in general practice, what would I do? And if this were to come as an AKT test or an SCA scenario, what would this look like? And what do I need to prepare myself? So the SCA has got 12 simulated consultation scenarios, and you get 12 minutes for each one of them. And you take this exam in your surgery, and it's like a video, so it's remote, and you have all of the settings prepared in advance. It's quite pricey, as you can see. The cost is 1,207, so that's a lot. So hence the importance of really preparing and making sure that you're ready. So in terms of preparing to make sure you're ready, you start obviously early on. Check yourself, check with your trainer, ask them from the feedback that you've been getting, do they feel that you're ready to take the SCA? Do you feel ready? Does your TPD think you're ready? So just sort of having those conversations is important. And the consultations, the scenarios that you get are varied. It's almost meant to simulate a particular surgery, say a morning surgery or an afternoon surgery, the sort of things that you would encounter. You wouldn't necessarily just see, one particular thing. It might be a phone call. It might be like a district nurse asking questions. It might be a paramedic wanting information or advice while they're seeing your patient in the community. So it's really varied. And managing the timing is also important because, as I said, it's 12 minutes. In different surgeries, as you start, you get different times. You might start, say, at 30 minutes. You might start at 20 minutes, and the time, keeps going down so that you can also get used to the time pressure of doing this. Yeah. So again, in terms of routine consultation or pre-booked consultations or complex cases or ethical dilemmas. So you get on your screen, you get sort of like a brief description to say this is what they are coming with. and that you're on a call, say, to a paramedic who's with this patient who's frail, end of life. Maybe you've seen the patient before, and then you take it from there. So there will be some information that you're given, but ultimately it's about testing, your data gathering, how safe it is, and in terms of the management, whether you're doing that management with the patient in a routine consultation. Is it a shared management plan? Is it a plan that is patient-centered? Because ultimately, it's really all about the patient. We'll go through some of the details of the structure of your consultation, the things that you're learning already in terms of understanding the ideas, concerns, expectation, and using this in the management and making sure that they are on board as well, checking understanding and all of those things. And making sure that it's safe. What's your sort of safety net like? So the marking sheet of the SCA is based on 3 domains. So there is communication or relating to others. There is data gathering and diagnosis, and then there's clinical management or managing medical